Hello, I am Dr. Shantaraj, Senior Pediatrician from Maya Multispeciality Hospital. I would like to speak a few words about fever, a very common entity seen in a child. Every mother is anxious when the child gets fever, and we should know what one should do and what one should not do. First of all, we should know what is fever. A temperature above 98.6 degrees temperature is taken as fever. And there are different reasons for fever. It can be a bacterial infection, viral infection, or so many other entities which causes fever. And normally it's very difficult. Some fevers come with cough, cold, loose motions, vomiting, convulsions. So majority of the times we will not know the reason for the fever unless we examine the child, investigate the child, and know the reason for that fever. So accordingly, when a child gets fever, please don't wait and waste your time. As early as possible, please go to the pediatrician or your family doctor and show the child to them to know the cause of fever and to put an end to it. Otherwise, you may be too late and you may land up with some complications. And one should know fever is always beneficial to us. See, when we get fever, the body temperature rises, and the intention of the body to develop high fever is to kill the organism. So majority of the infection subsides 1 day or 2 days after getting the fever. That's because body overtakes the power to kill the bacteria and makes it normal. So beyond that, if it continues, then we should be very careful because it has exhausted the level of the body's level to maintain the fever, and one should be very cautious then. There are some initial home remedies that should be done whenever the child gets fever. So one thing is give a lot of fluids to the child so that the child doesn't go into dehydration. Never give ORS or any fixed juices like Fanta, Cola and all. Always try to give tender coconut, buttermilk, fruit juices, homemade fruit juices. Never give ready-made juices because they have a lot of preservatives which may cause so many other issues. Other thing is tepid sponging. Whenever the child gets very high fever, wipe the whole body. Don't put any cold pack on the forehead because the area of the forehead is very small. It cannot take away the temperature from the body. You have to wipe the whole chest, whole abdomen, whole back, hands and feet with lukewarm water. Don't use cold water. They may get shivery. So use lukewarm water so that it evaporates faster as per the basic physics and bring down the temperature of the body in an early way without causing irritation to the child. So these two things are very important. After that, if the child is still running fever, you can give 1 dose of paracetamol, whatever brand you have, any paracetamol, whatever the dosage the doctor has recommended you as per your child's weight. You give that paracetamol, then go to the doctor and get it examined. And sometimes when they get very high fever, some children get fits. This is called febrile convulsions. Don't get panicked when you get febrile convulsions. Don't run to the hospital immediately. You give some first aid and then go to the doctor. Whenever the child gets convulsions, the convulsions are done to shake the body so that it aerates and bring down the temperature. That is the body's natural mechanism to bring down the temperature. So whenever you touch a hot thing, you do like this to get away the temperature because of the breeze. The same thing happens with convulsions. So don't get frightened. Only thing is you should prevent aspiration in a child. Put the child to one side so that the fluid collection will not block the airway. Breathing will be normal, and no need to give any iron key, iron rod and other things. You prevent the injuries from the surrounding things so that the child is kept in a safe position. After that, once the convulsion comes down, don't get worried. Then you can take the child to the hospital and show it to the doctor. And they will know they will analyze the reason for convulsion, and accordingly they will treat the child. So these are some of the very important things what you should do when the child gets fever. So don't neglect it. You are going to the doctor only to avoid the complications in future. I think that should be fine to say a few words about fever.